Exosome treatment for retinal detachment. Research into the potential use of exosome therapy for retinal detachment is still in the experimental stages. Exosomes have shown promise in delivering therapeutic molecules to target cells, and researchers are investigating their potential for treating various eye conditions, including retinal detachment. Exosome therapy can be administered via injection, making it a minimally invasive treatment option for retinal detachment. This approach reduces the need for extensive surgical procedures, which can be associated with greater risks and longer recovery times. Exosome therapy for retinal detachment involves the intravitreal injection of exosomes containing therapeutic cargo, targeting the detached retina. Post-injection, patients undergo regular ophthalmic examinations to monitor structural and functional changes. Evaluation includes imaging, visual field testing, and patient symptom assessment to gauge treatment efficacy and safety.